Have you ever thought, I don't smoke, so I'm safe? The truth is, you don't have to light a cigarette to be in danger. Just being near a smoker can quietly harm your body in ways you'd never expect. Secondhand smoke is a silent threat, and today we'll uncover what it really does to your health, why children are the most vulnerable, and how you can protect yourself and your loved ones. What exactly is secondhand smoke? When most people think of secondhand smoke, they imagine the puff of smoke a person exhales. But that's only part of the story. The even more toxic smoke actually comes from the burning end of the cigarette itself. Combined, this poisonous mix contains over 7,000 chemicals, 70 of them proven to cause cancer. And here's the alarming part. Even a few minutes of exposure is enough to trigger harmful changes in your body. The reality is simple. There is no safe level of exposure. How it affects your body. From the very first breath, secondhand smoke goes to work against you. It raises your heart rate, damages your blood vessels, and lowers the oxygen in your blood, forcing your heart to push harder. If you already have asthma, heart disease, or breathing problems, even short exposure can trigger serious complications. But the danger doesn't stop there. Over time, the risks keep piling up. Regular exposure increases your risk of heart disease by 30%, raises your chance of stroke by up to 30%, and significantly boosts your risk of lung cancer. Every year, secondhand smoke claims the lives of more than 1 million non-smokers around the world. The danger to pregnant women and babies. The risks start even before birth. Pregnant women exposed to secondhand smoke face a much higher risk of miscarriage, premature birth, low birth weight, and birth defects. Even if a mother never smokes, just living with someone who does can put her unborn baby in danger. Why children suffer the most. Children breathe faster than adults, which means they take in more of these toxins with every breath. Their small, developing lungs simply can't fight back. They are more likely to struggle to breathe at night because the smoke lingers in the home. The results can be devastating. More colds, more severe asthma attacks, and tragically, even sudden infant death syndrome. Growing up in a smoky environment doubles a child's risk of asthma and can even stunt their lung development, leaving them with lasting health problems that follow them into adulthood. Many people believe myths that make secondhand smoke seem less harmful. Some say, I smoke near a window, so the smoke goes out. Others think smoking in another room is safe, but the truth is, smoke doesn't stay in one place. It spreads and lingers. Worse yet, the toxins don't disappear when the cigarette is out. They stick to walls, furniture, clothes, and even dust. This is called third-hand smoke, and it's just as dangerous. Chemicals like nicotine and formaldehyde can stay in your home for weeks or even months. Children are especially at risk because they crawl on the floor, touch contaminated surfaces, and put objects in their mouths. Even stepping outside doesn't guarantee safety. If you're close enough to smell the smoke, you're close enough to breathe in its toxic chemicals. How to protect yourself and your loved ones. The answer is clear. Only a completely smoke-free environment can keep you safe. That means no smoking in your home or car, and choosing smoke-free restaurants and public spaces. If friends or family smoke, kindly ask them to do it far away from you, and especially away from children. And whenever possible, encourage them to quit, for their own health and for the people around them. Secondhand and third-hand smoke are silent killers. You don't choose them, but they can still steal years from your life. Protecting yourself and your loved ones isn't being rude. It's showing love, respect, and care. If this video helped open your eyes, share it with someone you care about. Awareness saves lives, and together we can create a safer, smoke-free future. Stay informed, stay healthy,